And welcome back to the Nutrimedical Report for Monday. And, of course, every hour is open lines. You are welcome to call in and ask any questions. There's no such thing as a stupid question. As they say, I only pounce on those people who say things that are going to be dangerous to my audience or are going to put people into harm's way. Just like a parent trying to grab a kid so that the truck won't back up over them or your pet dog. And just want to make sure that you are out there realize that we are here for you. Here at Nutrimedical, we try to provide the very best nutraceuticals and medical and wellness advice. As well, the best financial advice. We have carrot bars. Pete Fedek will be on the third hour today. And the best spiritual advice. We are strong Joshua-type Messianic Christian believers. And it is the only situation which is a relationship with the Most High God. Everything else is what I call a real lies going on. So let's talk with Clay now about NutriMeds. Clay, we've got some pretty neat things that are coming on later in the fall and October, but I don't want to let the cat out of the bag. We have some amazing nutraceuticals here right now at Nutrimedical. We're in the midst of summer, and people are getting sunburns, people are getting strains and strains. People are trying to lose weight by exercising and dieting, although I think some people are probably drinking more of the types of foods and eating more foods that they probably are going to pack weight on their middle. What kind of advice would you give people from our NutriMeds list to keep them healthy and well during the summer and creaky-free from their joints and so on?
I really like the Vitamin Mineral Max. It's just a strong foundational support for all the listeners, and it's just a very, very high-quality multivitamin, multi-mineral support product, something you take every day. What's nice about it is it has all activated B vitamins, so they're body-ready forms, easy for the listeners to absorb and feel a difference on. It's got amino acid chelated minerals, so they're going to be able to absorb them. They come in a veggie cap. They're easy to swallow, inexpensive in terms of the price, so it is the highest quality ingredients. I don't know how you charge so little for such a high-quality supplement.
Yeah, you can't really compare it to anything else in the market because everything else is, number one, not bioavailable, not to its final metabolic stage converted, so the body has to convert it. Even the best organic food is not bioconverted to its final metabolic stage, which means it's going to jump over any gene defects you have, polymorphisms we call, or SNPs, SNP, or metabolic blockades caused by toxins. So there's really no comparison, is there?
No, none that I've been able to see.
And, of course, the Vitamin Mineral Max principles are also in all our other vitamins. Minerals Plus, Life Support, everything that we carry, Ageless, Energize, they all have the activated forms of the vitamins. I'll give you my short list of what I call the summer survival vitamins. Firstly, the one is a cream, curcumin cream. If you get a burn, you want to spray Silver 100 or put Nutridyne on the burn right away. I like Silver 100 because it's the Nutridyne we use for real deep burns, but Silver 100, then you want to slap on curcumin cream and take cell defense tablets internally, which is curcumin, which is a very, very powerful what we call adaptogenic nutraceutical to help not only modulate inflammation but stimulate healing and regeneration. The next is for weight loss. We use a combination of Green Tea Select and LipoFlush. Very, very powerful combination along with NutriDefense. That's a powerful combination. The research has shown if you take LipoFlush, 2 soft gels twice a day, and I often tell people you can go up to 4 twice a day and you increase your weight loss. You will literally flush fat right out of your body. It's amazing. And use it along with Green Tea Select, which boosts your metabolism, burning off the fat, and NutriDefense. So that triad, NutriDefense, I also add to that, because of the BioPerine, increases absorption of the LipoFlush and the catechins, the polyphenol and NutriDefense and the Green Tea Select. Is vitamin C, the Power C+. So that combination is very powerful for weight loss, isn't it?
Yeah, there's been all kinds of really great studies surrounding the active ingredient in LipoFlush, and shown to be as little as 3 grams a day to help the listeners burn body fat. Actually helps to lower body fat amounts just by taking 3 grams a day of the active ingredient.
It also, what it does, too, is it gets rid of the bad fat. Bad fat we call angry fat, fat that actually can cause vascular disease, fat that can cause insulin resistance, fat that can cause hypertension, etc. We call the angry fat. Next thing is trying to stop the joint tenderness and so on. We have Tendon Mender, Joint Performance, Collagen Max, and Inflamex. Let's talk about these, because if you've got creaky joints, you've been exercising or doing things that you maybe haven't done for a while, we call summer warrior activities. You need to protect your joints. You also need to speed the healing so the micro-injuries don't become a macro-injury where you tear a ligament. So let's talk about that for a second. Collagen Max triples the rate with 1 capsule a day. I usually recommend 1 twice a day of Collagen Max. I recommend with that the Joint Performance and Tendon Mender 1 to 2 twice a day, and a larger person 2 twice a day. Tendon Mender, which changes the tenocytes and fallout fibroblasts, and Joint Performance to regenerate the joints. And then I like to add to that Inflamex, anti-inflammatory Inflamex, and Mountain Red Velvet. So let's talk about these for a minute, because a lot of time people get ligamentous injuries and it kind of sidelines them during the summer. They say, oh, gee, I blew my knee golfing or running or cycling. And now the rest of the summer they're sitting around, getting tanned or sunburned. It's important to try to keep yourself in the field, isn't it?
Oh, yeah, for sure. And these are the raw materials that your body needs to help build type 1, type 2 collagen in the joint, rehydrate the tissues with hyaluronic acid, and really just help bring down inflammatory mediators within the body. So everything you need there in those products that you just mentioned.
Now, one of the things we try to do is we always try to get your mitochondria going, get your energy level up. And we have some pretty neat products. The first triad, of course, is Anti-Age Max, which literally slows aging. It actually lengthens your telomeres, prevents cholesterol oxidation, and helps to lengthen the lifespan and the health of your mitochondria, along with Supernox, which is very, very special formula. It includes actinose and other things so that you don't end up with the bad nitric oxide stimulation, you get the good one. And Nutrimedical, which I think is one of the most important nutraceuticals because it regenerates your fat and water-soluble antioxidants. Tell us about this trio and how important it is for your mitochondria.
Yeah, one of the things that you can do to elongate life is calorie restriction and vigorous exercise. What those two things do is they activate the SIRT2 and SIRT2 genes, which tell the body to repair itself in a really positive way. And so what you're trying to do is mimic those with nutrients, and that's where these triad of the Anti-Age Max, Supernox, and the Nutrimedical come in. The Supernox increases nitric oxide, which helps with blood flow, repair, performance, increasing, in some studies, nitric oxide has been shown to increase growth hormone. Anti-Age Max helps to activate SIRT2 genes and polyphenol. It helps with a master regulator of appetite called AMP kinase. So that's a very important part. And then last but not least, you have Nutrimedical, which is a controlled-release form of alpha-lipoic acid, which helps to support blood sugar metabolism. And when you put all three together, they do activate the same gene transcription factors that exercise and calorie restriction do activate.
Now, that trio goes along with the combination of the following. Cell detox glutathione, which is very important to protect your eyes, your peripheral nerves, your central nervous system. If you've got a neuropathy, occipital neuritis, temporal mandibular joint problems, cervical or thoracic or lumbar radiculopathy, chronic peripheral neuropathy, diabetic, non-diabetic. Cell detox glutathione, very important. We have carnosine to stop singlet oxygen, and we have, of course, the use of the Nutrimedical, and then we have Regenerex. Let's talk about this for a minute because it actually stimulates the genes. I guess I hear the bumper, so we're going to have to hear about these right after the break from Clay. And back in a minute to keep your summer sunny and keep you active so you don't end up with nerve injuries and you lose the weight, stay healthy, keep your blood sugar good, your blood pressure. We'll be back in just a minute. They go perfectly with our mitochondrial support trio we just talked about. Cell detox glutathione, carnosine, Regenerex, and Nutrimedical. Let's talk about Regenerex and cell detox glutathione. These are extremely important. If you've got a chronic pain syndrome, neuropathy, and again, people need to understand this. By the way, for doctors out there that aren't trained in intermediate metabolism, biochemistry, toxicology, etc., they need to understand that Most neuritic pain syndromes, even if you've got an abnormal MRI scan, has nothing to do with anatomical encroachment. If you do a CT myelogram or you do a MRI myelogram, you very rarely will you actually have an anatomic encroachment that actually is causing gliosis of the spinal cord or the nerve root. It's usually a mild irritation to the dural nerve sleeve, and the big problem is the chemical irritation causing tumor necrosis factor alpha, slow reactive substance of anaphylaxis, IFN gamma, and other cytokines that cause the pain syndrome by stimulating the neurolema, the outside of the nerve sheath of the dural nerve sleeve, which is highly innervated. So a lot of people get told, well, we need to do surgery. No. What you need is you need to turn off the inflammation and the free radicals. So not only things like Inflamex and cell defense to turn off the inflammation and downregulate the cytokines, but you need high-dose power C. Yeah, you need Allergon, which is literally our histamine remover. It's not an antihistamine, it's a histamine remover. But the most important thing are free radicals, and cell detox glutathione for nerves, spinal cord, brain is probably the most important. And then, of course, carnosine, Nutritrella, and Regenerex. So let's talk about these for a minute.
Yeah, the cell detox glutathione, I just love that product. It's as effective as IV glutathione, and really that's unheard of until a few years ago, so this product came out.
Right. By the way, I use it for bronchiectasis and asthma, too. I tell people get a mortar and pestle and grind it down, a small little mortar and pestle, and put it in there. My Pure Mist or an Omron or Sunnypulse Elite, and if they take that, it literally will dissolve and turn off lung inflammation. So you don't need a rescue inhaler. You just need our Nutridyne with the perhaps Silver 100 inhalation, but the Nutridyne and cell detox glutathione is an inhalation. Just grind the powder down so it's a very fine, absorbable form, and it'll literally turn off the inflammatory changes in the lung tissue.
Yeah, well, what is that? You're speaking of asthma caused by inflammation specifically? Any
lung inflammation, chronic, exposure to asbestos, bronchiectasis, chronic cystic fibrosis, chronic asthma. It doesn't really matter. Any lung condition, it's all upregulation of hydroperoxy radical that's causing the inflammation of the lung tissue. And if you get cell detox glutathione in there, it just shuts it off, because prostaglandin E2 and F2 are the primary long-acting inflammatory cytokines in lung tissue, and you can turn them off by using that.
Why do kids typically outgrow their asthma?
What happens is asthma is caused by, in children, the presence of chronic rhinovirus subclass 3 and other chronic infections, and their immune system gets mature enough it can kick it out. Some people don't outgrow it. And chronic asthma, the drugs actually cause inflammatory changes, so you get a restrictive lung changes to people that use chronic beta agonists, such as Ventolin or some of the other long-acting inhalants. They actually cause restrictive lung changes and scarring of the lungs. So your doctor tells you that it's perfectly fine to take this forever, you're nuts. These rescue inhalers will actually do damage, and if you use long-term steroids, you'll get massive mycobacteria and fungal infections in your lungs. And it also covers up stealth infections of viral infections in the bronchi and respiratory bronchioles and basket cells. So a lot of time when the doctor will tell you that there's no infections there, they're wrong. Rhinovirus subclass 3 and chronic mycobacteria and fungi love to grow in lung tissue.
Mm. Yeah. Interesting.
So, yeah. Yeah, it's very interesting. And that's why when you use our antipathogenics, we use cell detox glutathione, and I just got a report today about a lady who's actually a professor. She was deathly ill, and her son asked me, and I sent him a protocol which include that with my Pure Mist, which you can get at Amazon or an Omron, and we're able to turn off literally the inflammatory changes almost immediately. It's amazing. Also, things inflammation in your liver. Liver inflammation is usually hydroperoxy radicals, the primary and most nasty of them. And so if you're getting a chronic hepatitis and you take cell detox glutathione, you're going to turn off a lot of the things that will cause sinusoid scarring and liver portal hypertension.
Oh, good. Yeah, if you
so a lot of people aren't aware that
increased liver enzymes, would you recommend the glutathione?
Yeah, okay, and selenium cruciferate as well as Minerals Plus, because if you don't have a significant amount of selenium, so I recommend the Minerals Plus and Vitamin Mineral Max, Minerals Plus, and selenium cruciferate to get a little extra selenium as a cruciferate form, organic chelate. Interesting, eh?
Yeah, very good.
Yeah, so you're able to see, if we were able to do what I call a free radical scan, which is based on some of the technology I've theorized to build a field ion scanner, Linus Pauling theorized many years ago, you could actually see the free radicals and the frequency of them in a three-dimensional space, say over an organ, like your heart or liver or brain, and you'd see the cell detox glutathione be able to turn off brain inflammation. So you get a concussion. One of the first things to take is cell detox glutathione, as well as taking cell defense, which is curcumin, which will cross the blood-brain barrier, and phospholipids to repair the myelin sheath, Nutriphos and Neurogen, and of course you need the trace minerals, copper and zinc, and the other trace minerals in order to shut down the inflammatory reaction. And we call BOF, for brain on fire. So when you see these vaccine injuries, like $3.5 billion paid out for vaccine injuries in the last 20 years by the U.S. government as a vaccine court to protect the vaccine industry, which are a bunch of criminals, $3.5 billion means somebody's been hurt, right? The primary thing that'll turn it off is cell detox glutathione. So if you have a child with autism or you're trying to say, someone's been vaccinated, how would I protect them? Number one is cell detox glutathione, and then the phospholipids to repair the brain, which is omega cod liver liquid, Nutriphos, Neurogen, the trace minerals and Minerals Plus, Vitamin Mineral Max, and Copper Regenamax, which is very important for solid organ regeneration. You can't repair phospholipids in any solid organ without copper and zinc in the right ratio. Interesting. So, that's that kind of neat combination. The thing about Nutrimeds is they're very unique. It's not just having these tools. It's knowing how to use the tools. It's like having a tool chest and not being trained as a NASA engineer how to work in space and repair, say, the space shuttle or a satellite that, we have to go out in a tether and do that. Well, it's the same thing. Although the protocols are pretty straightforward, there's an awful lot of science behind these when they launch, like carbo block and lactose blocker to block milk lactose, which also can wreck your bowel. Neat stuff. So for the next hour and a half, we're going to do wellness open lines on any wellness topic. We are going to have up in hour number 3 John from Nutridyne, and Pete Feddick will be back with talking about the carrot bars. Back in a minute. And Dr. Bill, I'm back. The caller line to call in for questions is 800-259-5791. And I'm going to go through some of the Nutrimeds to kind of explain exactly what some of them are, because they're very advanced and complex in many ways. I had a request this morning about someone with chronic fatigue and adrenal support problems. The first thing we recommend, our adrenal gland support is both a glandular and activated vitamins. So it's very unique. Very often you'll find that when the adrenal glows, the thyroid is going too. So I usually recommend a pair of mitothyroid, 2 capsules twice a day, and adrenal support at least 1 twice a day. You can follow it up by going to directlabs.com and getting a salivary test for adrenal hormones in your saliva, which is the unbound form, which is the best way to measure it. And they can do data points during the day to look at a diurnal pattern to see a normal daylight pattern of DHEA, cortisol, and melatonin. I usually will, in the next stage, add DHEA and pregnenolone, 25 milligram tablets of DHEA, 1 to 2 for female, and 2 to 4 for male, and pregnenolone usually 100 milligrams in the morning of either. Next is ageless chocolate and vanilla. Of course, the ageless is an amazing formula, antioxidant formula, detox formula, immunoglobulins, desulforifying glycosinolate, DNA repair, and anti-cancer effects, and literally life extension. So the age less will help you age less. We often combine it with, of course, life support. ALC 1000, this is acetylcarnitine, and it combines to restore ATP and NADH. When you use ALC 1000, I usually recommend using it with D-ribose, which converts directly to ATP, and using NADH tablets, 1 to 2 tablets twice a day. of the NADH, which is nicotine and adenine dinucleotide hydride. We actually have the tablets now. Aller Block is a natural antihistamine, and we use this for allergies. We also have Allergon, which is not only for allergies, but autoimmune diseases, inflammatory conditions, and chronic, we call cytokine disorders like chronic fatigue syndrome, etc., and elevated histamine that can affect the brain, as well as many other organ systems. We have, of course, Allicin Med. We have the German standardized high-potency allicin, so it's higher in concentration than anything else, including our Alamax and Alamed. The Alamed, it's 200 milligrams more per capsule than Alamed, and about half the price. So it's an amazing deal. This kills all known pathogens, goes through the biofilm. It doesn't matter if it's periodontal disease, vascular disease, brain, liver, hepatitis C. It's one of our big 3 antipathogenics. Nutridyne, Allicin Med, Alamac, and then, of course, Silver 100, which is the only ionic silver in the world. There is no other competitor, and they'll try to say there is. They are not. They're not competitors. They don't even belong on the field. They have nanoparticles which have no biological action whatsoever, whether they're colloidal or nanoparticle. Doesn't matter what size they try to market. Hydro, this, that. It doesn't matter. We have, of course, the berberstatin. This is a gut pathogen yeast and parasite cleanser. Berberstatin, excellent, along with Allicin Med. If you special order it, we can get you the Gastro Cleanse. I tell people only get 1 bottle. It's that strong. You do not want to repeat it. It's Saccharomyces boulardii. But if you ask us, we will get a special order for you for the Gastro Cleanse. BioLVR. This is a methylation formula. It used to be called methylation enzyme activators because the name was too complicated for people. BioLVR works on restoring methylation pathways, removing toxins in the liver and the body, removing heavy metals, and methylation, which is important for digestive enzymes, myelination of your brain and peripheral nerves, and many other processes, especially the process of converting, along with tryptase and pyrrolase enzymes, amino acids to neurotransmitters in your brain. So it's a really important factor, and it has activated B6, activated B12, and activated folate. Now you can get higher concentrations of B12 and folate in superfolate, pyromethyl B12, but this is a combination formula that's excellent. I usually take 2 of the BioLVR twice a day because it has the activated B6, which is the highest concentration of any of our formulas for B6, which is really important in many different processes. By the way, this is the one that will make your urine turn yellow, and it's yellow because of the pyridoxal 5-phosphate form of B6. The BioLVR is very important for enzymes, getting rid of heavy metals, trying to do all kinds of things in the body. We have Bladder Up. Bladder Up, of course, naturalizes normal bladder activity, hyperactive bladder, usually a soft gel morning and night. It's a pumpkin seed extract, very natural, very safe. And we usually use it along with Swedish flower pollen, which is a natural alpha-1 blocker. Instead of the toxic drug that can have nasty side effects in your eyes and blood pressure, use Bladder Up and Swedish flower pollen. 1 to 2 tablets of Swedish flower pollen every 4 to 6 hours for bladder irritability, whether it's females with trigonitis, could be ureaplasma or just pressure from the uterus, or males with prostate hypertrophy, which of course will use prostate flow to reduce the prostate gland size, and hormone synergy, which will reduce the female type hormone effects, and the xenoestrogen detox to remove the xenoestrogens. The BioLVR is very good with that, as well as NutriDefense, removing xenoestrogenic molecules from the body. So NutriDefense, Green Tea Select, and BioLVR, very powerful for that. We have Bone Generator, and this is the bone crystals. It's the actual bone hydroxyapatite crystals, silica, boron, and manganese, and all the trace elements necessary to restructure bone. Of course, you want to build it on the rebar, so you want Collagen Max. I recommend Collagen Max, number 1, for rebuilding bone, and it triples the rate of the proline transhydroxylase enzyme. Take MyCell D3, usually 3 soft gels twice a day. It's very important for your granulocytes to fight cancer and infection. We talked about the last week with the GCMAF. By the way, I can obtain it for you or give you the contacts. You can obtain it yourself from the suppliers in Europe if you're trying to fight a number of conditions, including autism, cancer, MS, chronic fatigue syndrome. So GCMAF, it turns out the costs are around $100, I think, per injection twice a week. Very effective at helping boost the immune system. And when we return, we'll take your questions, or I'll just keep plowing on to explain in more detail how to use our powerful NutriMeds Your questions are welcome, 800-259-5791. Yeah, I'll continue plowing forward. We have, of course, Brain Mag. Brain Mag, of course, is an anti-anxiety, brain protectant. The research studies on humans and animals have actually shown that if you take Brain Mag, it actually stops the S100 protein, neurofibrillar tangles, and inflammatory changes in the brain. I love the combination of Calm Mind and Brain Mag. In fact, I take usually 2 to 3 scoops of each at bedtime. During the day, I would mix it in my drink of Sports Energy Light, which I'll do at the top of the hour with Brain Mag, usually 3 scoops of Brain Mag during the day, maybe 1 scoop of the Calm Mind, so don't start snoring during the show. Not likely. And put in there D-ribose, ALC-1000, and of course I take my NADH tablets. This is superpowered energy, and if I say the Brain Mag is extremely important for brain protection, both central and peripheral nerve systems. So if you've got peripheral neuropathy, central problems, concussions, concern with your relative about Alzheimer's disease, we use a combination of Cognition Plus, Brain Power, and we of course have Synaptin. We use the Brain Power along with the Brain Mag in order to protect the brain. Calm Mind. This is a combination of xanthine, L-theanine, GABA, which is gamma-aminobutyric acid, and myo-inositol, a special B-type vitamin to protect the brain and protect the neurotransmitter levels. I love the combination. Cherry Calm Mind goes off the shelf literally. Sometimes people buy flats of it. It's amazing. KNC eye drops. If you're having an eye problem, glaucoma, cataracts, fluctuating eye conditions, the combination of Vision Max and KNC eye drops, and I usually recommend Silver 100 because there's often low-grade eye infections either in the tear duct part of the eyes, which is associated with the ethmoidal sinus cavity, which often communicates with the eye, but also you want to make sure you don't have low-grade eye infections inside the eyeball itself, which can often occur, especially in diabetics. And lots of other strange infections like toxoplasmosis actually grow in the eye. Carbo Block. This blocks carbohydrates. If you want to lower the peak surge, the surges of carbohydrates are like a sledgehammer to the body cells. It cross-links proteins, produces singlet oxygen, and destroys enzyme activity in the body. So Carbo Block is very good for especially not only diabetics, but people just trying to control insulin surges. Now, insulin, of course, drives by a cue ball effect, increase in glucagon, and glucagon can take protein in your liver and kidneys and actually make sugar. So Carbo Block is a really good addition to Glycemex, leptin metabolic, which lowers and it raises your insulin and leptin resistance problems, gets rid of it, along with Minerals Plus. It does a lot of the minerals for reducing diabetic insulin resistance, and chromium cruciferate. Chromium cruciferate, very good form of biologically bioavailable chromium. We have Cell Defense, we talked about earlier. This is probably one of the most important nutraceuticals you can take to prevent cancer, prevent inflammation of the brain and other tissues. It crosses the blood-brain barrier, solid organs like the liver. I recommend 2 Cell Defense at least twice a day. Some people can take more, like 3 twice a day. Cell Detox Glutathione. This is probably one of the most important breakthroughs. We hear about whey protein, and whey it's a good protein, but nothing like this. This is many thousands of times stronger in terms of getting rid of singlet hydroperoxy radical, which is detoxing the body from heavy metals and toxic chemicals. Cell Detox Glutathione is the actual glutathione enzyme, so it's amazing stuff. Clelar Max. Recently had a visit with my dentist, Dr. Jeffrey Curbs, and when I go back in to see him next week and get my final crown, because I got all my mercury amalgams taken out, he did a wonderful job, is Chelor Max. And Chelor Max is the best oral chelator. We also pair that with our ultra-liquid zeolite. Do not take things like clay, because clay only works in your gut, like bentonite clay. These clays are chelator agents, and they're very inferior compared to ultra-liquid zeolite, or especially Chelor Max that works throughout the body and the circulatory system. Chromium cruciferate. This is a form of chromium grown at Johns Hopkins University research there, and 200 micrograms per capsule. I strongly recommend if you're diabetic or have elevated blood insulin. A lot of people don't know they have elevated insulin. Normal fasting insulin is around 2 microunits per mil. And if it's above that, you have insulin resistance, or we call syndrome X. And there's a ton of people who have it. Polycystic ovarian syndrome, anybody with a tendency to gain weight, anybody with Hypoglycemia has a problem with variable insulin resistance. That's why you'll see some diabetics that use a ton of insulin one day and the next day they don't need it on a sliding scale, is they've got variable insulin resistance. So chromium cruciferate will help to take out those highs and lows and reduce the need for blasting themselves some days with insulin. And of course, if you take our diabetic protocol and follow a George Cruz low-carbo diet, which he has an online support protocol too, I think, so that his is the best program I see out there. It's better than the paleo diet. They even have breads if you want to make them with almond and coconut flour. So you can make your own that doesn't have, quote, carbos in it. Carbos are bad, and sugar's bad. And our society, of course, is loaded to the gunnels with carbohydrates that are rapidly absorbed. Even bread 100 years ago, grown on stones, would take a day or so to absorb and include little tiny stones as well. Ancient Egyptians, by the way, when they had their breads, it ground down their teeth, so a lot of them, their teeth was ground down by the fact that there were tiny stones in their food, believe it or not. Cognition Plus, this is a very powerful brain and memory formula. There's a mini-series coming on this fall. One of the components of vinpocetine is actually in the formula. We have, of course, huperzine A, which is the one that they talk about this movie Limitless. There's actually a mini-series coming on this fall about that on DirecTV. You need to know you can do this now. If you start taking Cognition Plus, you will raise your IQ, you'll raise your memory, you'll protect your brain from what we call losing multitasking capacity. There are 3 phases to memory, what's called the virtual phase or the neural network phase. There's then what's called synaptic facilitation phase, and there's finally what's called the neurotubular phase. And of course, most neuroscientists are not aware of the neurotubular phase. It's a non-local way for the body to download neural frequencies and networks into a molecular form called neurotubules, which are present in every cell in your body, but they're particularly high concentrations in nerve cells. So all cells have microtubules. And as I say, this is important to understand that. We have, of course, the collagen max. We talked about this earlier. It raises the rate of regeneration of collagen, elastin, and hyaluronic acid, so it rebuilds joints, connective tissues, skin, plumps up the hyaluronic acid in your skin and your eyeballs, and the hydroviscous layer in your joints. So it does a whole lot of stuff, including making stronger elastin. So if you have aortic aneurysm, the first thing I prescribe is, believe it or not, for your heart and your arteries, and to make sure your aorta doesn't expand or tear, is Collagen Max. And then, of course, the next thing is we have your pressures down, which we use Cardiovasc, Gamma E+, magnesium glycinate malate, magnesium taurate, VascuCare carnitine, CoQ10 ubiquinol first. It's water soluble because it works in the heart and brain, and CoQ10 Supreme as well. And of course, we want to make sure that if we need to stop arrhythmias, we use Forskolin. So that's just a starter. And then omega fatty acids, omega supreme krill, and omega cod liver liquid to reduce the hydroviscous layer of your and viscosity of your blood. We use the nattokinase, which will reduce the C-reactive protein and plasminogen activator inhibitor that are inflammatory markers. And we use lumbrokinase if you had a previous vascular event or high calcium score in your high-speed CT scan or ultrasound, B-scan ultrasound of your carotids or vertebral arteries if it shows positive, which I tell people a screening a scan in your 50s is a good idea, or 60s. Or if you have any symptoms of a transient ischemic attack, you want to make sure that you don't have any high score B-scan ultrasound changes or high-speed CT changes indicating high chances of unstable plaque. And a cod liver liquid, of course, is going to lower your cholesterol. It helps restore solid organs. It's the best thing for restoring normal bile. I just got a consult this morning about a lady who's going to have her gallbladder removed. She wants to make sure she takes the right thing for bile. First is cod liver liquid. And number 2 is Nutrifos, and number 3, Neurogen. And then, of course, the minerals to support that, which are Minerals Plus and Copper Regenamax. Copper Regenamax. So if you take those, you're going to make good bile. We need bile to absorb our fat-soluble vitamins A, D, E, and K, phospholipids to rebuild any solid organ and tissue. And we'll be back in a minute with your questions, 800-259-5791, any health and wellness questions. Coming up in hour 3, we're going to have John on Nutridyne and Pete Fedek with carrot bars. We're having an amazing amount of interest and action. and get in our network now, or in 6 months we're going to build it like crazy, and we're putting people downline of you, so we're your partners in building your business. Mine was filled the first day, believe it or not, because you only have a left and right leg. Everybody that I sponsor goes under one of you downline. We'll be back in a minute with hour number 2, 800-259-5791. Stay tuned.